Hey, November is National Diabetes Awareness Month, and this morning we're talking about that, and we're having a diabetes myth buster. Most patients with diabetes believe that the only way to control blood sugar is by eliminating all the foods that they like. So is that true or false? Well, joining us this morning with the answers is Ann Redwine. She's a registered dietitian and certified diabetes educator at Baptist Health. Ann, great to see you.
Nice
Happy
to
early
see
Thanksgiving.
You. Happy Thanksgiving.
Thanks for bringing in a pre-Thanksgiving meal for us here.
Yeah.
We appreciate that. Always good to eat this time of the morning.
Absolutely.
And always a day in Thanksgiving where people feel like they're eating more than they've eaten all year long. And Allison was mentioning earlier how some people preparing Thanksgiving, getting the meal ready, and having someone with diabetes at the table, knowing what to prepare for them, maybe some tips out there. Let's bust some myths this morning.
Okay.
All right, so what's the number one thing you hear from people out there in terms of diabetes? Number one myth buster you want to get out?
I can't eat anything white.
Anything, which includes turkey, right? Yeah.
Right, right. So, and milk.
And all the good things.
Right.
Cornbread even at some point. So what are some tips you would have for people out there who might be struggling with finding out what to put on the table for Thanksgiving, who didn't really think about having someone with diabetes needs to be concerned?
Well, I would say fix your normal dinner and let the person with diabetes eat wisely.
Okay.
Because they usually know how.
What about sweets? Sweets seem to be a big thing that people get concerned about.
Yeah, there's a myth that people with diabetes can't eat sugar.
Yeah.
You can eat sugar. You just have to do it smartly.
Okay. Be wise with your sugar intake.
Right.
What should they think about? You have a display right here, and on all the different grams, what is this illustrating here? With what kind of grams are we talking about?
They're grams of carbohydrate.
Okay.
Carbohydrate is the part of food that when we eat it, it directly turns into blood sugar. So that's the part of food that's going to affect someone's blood sugar the most.
Carbs.
Carbs.
Carbs get a bad rap, don't you think?
Right. They get a bad rap. There's 50% or more of your calories should come from carbs.
50%.
50%.
Let's look at this nutrition facts guide that you brought us today. This is something you should see on every food item that you buy as required. Break down some of the things here that you'd like to highlight, especially look at the carbohydrates.
Right.
Okay, so and it's illustrating a certain serving size. I know that's something, too, as a dietitian, you always remind people about.
Right, right. So the first thing on a label you always look at is the serving size, because that's the amount of food they're referring to. All of these amounts of things are in that serving. If you eat 2 servings, you're going to get double everything listed there. But for diabetes, we're most concerned about the total amount of carbohydrates you're eating at one meal or at one time.
One sitting, okay.
Right. So the usual amount we shoot for women is 45 to 60 grams, and for men, 60 to 75. That's to maintain weight.
Okay.
So you want to look at your serving size and total carbohydrate. People worry about sugar, but sugar and fiber are already in your total, so you don't have to do anything with those. Okay,
because that's one of the main things people look for when it comes to diabetes. Like you mentioned, sugar, sugar, sugar. So looking at this table right here, which looks like a full Thanksgiving meal, exceeding the advised daily intake of carbohydrates, correct?
Right.
Okay, so portion size, obviously important. Okay.
And the strategy I usually recommend for Thanksgiving, because people do like to eat a lot at one time, to help keep your blood sugar even, is you can have all the foods, you just kind of have to space them out throughout the day. Try not, if you ate all of this at one time, your blood sugar might go too high.
Okay.
But if you had part of it, and maybe you saved your pie till afternoon snack, and usually people go back later on in the day and get more Thanksgiving leftovers, you can eat all the food you want, the regular foods, you just kind of have to space them out throughout the day rather than eating them all in one sitting.
All right. Ann, thanks so much for coming in today. Happy Thanksgiving again.
Happy Thanksgiving.
For more information, you can always call the Baptist Health Line. And coming up at